Somewhere between the invention of the pharmaceutical pill and the rise of the modern garden center, we forgot something. Not something small, something that healers, farmers, and ordinary people relied on for hundreds, in some cases thousands of years. Specific plants. Plants that grew in hedgerows and meadows, on riverbanks and forest floors, that people once knew by name, the way we know brand names today. And then, gradually, they disappeared. Not from the earth, from our awareness. Most of them are still out there, growing wild, ignored. Some of them are treated as weeds. Here is what makes this more than nostalgia. In the last 3 decades, scientists have gone back to those forgotten plants, and what they are finding is extraordinary. Not anecdote, not folklore, but peer-reviewed, published, reproducible science, showing that several of these plants do things that modern medicine still struggles to do, often with fewer side effects, lower cost, and no single company patent. This video covers 10 of them, ranked from remarkable to genuinely astonishing. By the time we reach the last plant on this list, you will understand why something growing in a damp meadow right now may be one of the most important stress response tools on the planet, and why a Cold War military program discovered it before the rest of the world caught on. If that sounds like something worth knowing, make sure you subscribe and ring the notification bell. Every week we go deeper into the plants the modern world forgot and the science that is quietly bringing them back. Let us begin. Number 1. Lemon balm, the forgotten calming plant growing in your neighborhood right now. Lemon balm, Melissa officinalis, is almost certainly growing within a mile of where you are sitting. It spreads freely in gardens, colonizes roadsides, and has been cultivated across Europe and the Middle East for over 2,000 years. In medieval monastery gardens, it was considered essential. In the 18th century, Carmelite nuns produced a famous nerve tonic from it that was sold across Europe for over 200 years. Then it faded, not because it stopped working, but largely because it couldn't be patented. Here's what the science says. A study published in Psychosomatic Medicine administered a standardized lemon balm extract to healthy volunteers and measured their response to a laboratory stress protocol. The result in that trial was a significant reduction in anxiety and significant improvement in calmness and memory performance. A systematic review published in the journal Nutrients confirmed similar findings across multiple trials, identifying rosmarinic acid and specific flavonoids as likely mechanisms. Both compounds appear to inhibit enzymes that break down GABA, the brain's primary calming neurotransmitter. That is the same neurotransmitter system that benzodiazepine drugs act on. The difference is one of degree and risk. Lemon balm appears to modulate that system gently, with a lower risk of dependency and less cognitive fog reported in trials than is typical for prescription anxiety medications. It grows as a weed. It asks for nothing, and for decades, most people have been pulling it out of their flower beds. Number 2. Meadowsweet, the plant that gave the world aspirin. Before there was aspirin, there was meadowsweet. Filipendula ulmaria grows in damp meadows and along riverbanks across Europe and Asia, producing clouds of creamy white flowers with a faint smell of almonds. Traces of it were found at a Bronze Age burial site in Scotland alongside other medicinal plants, valued enough, it seems, to be placed with the dead. In the 19th century, German chemists isolated compounds for meadowsweet and identified salicylaldehyde from its flowers. A related compound, salicin, extracted from meadowsweet and willow bark, became the foundation for acetylsalicylic acid. Bayer named their new drug aspirin, derived directly from the old botanical name for meadowsweet, Spirea ulmaria. The plant that made aspirin possible is named inside the word itself. But here is what most people do not know. Meadowsweet contains a full spectrum of natural salicylates that behave differently from isolated aspirin. Some studies suggest that compared with isolated aspirin, meadowsweet's tannins and flavonoids may protect the gastric mucosa, a naturally buffered anti-inflammatory effect described in the Journal of Ethnopharmacology. The pain-relieving chemistry comes with components that, in certain preparations, seem less likely to produce the stomach irritation associated with synthetic salicylates. It still grows wild in every wet meadow in the Northern Hemisphere. Most people walk past it without a second glance. Number 3. Valerian, the sleep research that no one is funding. Valerian, Valeriana officinalis, has a reputation problem. The dried root smells, without exaggeration, like an unwashed gym kit. That smell is valerianic acid. Valerianic acid is also the reason it works. A meta-analysis published in the American Journal of Medicine reviewed 16 randomized clinical trials of valerian for sleep disorders and concluded that it improved sleep quality in many trials, with few consistent side effects. However, study quality and results vary across the literature. Research published in Pharmacology, Biochemistry, and Behavior identified the mechanism. Valerianic acid directly modulates GABA-A receptors, the same receptors targeted by zolpidem, the active compound in Ambien and similar prescription sleep medications. The critical difference suggested by clinical work is that valerian appears to produce calming, sleep-promoting effects without consistently altering normal sleep architecture, with little evidence of dependency in most studies, and with less reported morning grogginess than many synthetic sleep aids. Roman physicians used it. Medieval healers prescribed it for trembling and nervous exhaustion. Today, it is still available in every health food store, largely ignored, poorly standardized, and rarely taken seriously. There is limited financial incentive to fund large, standardized trials that would push a meadow plant into mainstream prescribing practices. 3 plants in, and a pattern is already forming. These are not fringe remedies. They are plants with documented mechanisms of action, peer-reviewed outcomes, and centuries of consistent use behind them, abandoned not because the science failed, but because the science was never profitable enough to pursue. The next plant on this list was tested directly against a prescription benzodiazepine in a controlled clinical trial. The results were published in a peer-reviewed journal, and the plant won. Number 4. Passionflower, the plant that beat a prescription drug in a clinical trial. Passiflora incarnata is native to the southeastern United States, where Cherokee healers used it as a sedative and anti-anxiety remedy long before European contact. Spanish missionaries encountering it in the 16th century named it after the Passion of Christ, seeing symbolic shapes in its extraordinary geometric flowers. It has been used medicinally across 3 continents for centuries.
Then came the trial that should have made headlines. A double-blind, randomized controlled study published in the Journal of Clinical Pharmacy and Therapeutics compared passionflower extract directly against oxazepam, a prescription benzodiazepine, in patients diagnosed with generalized anxiety disorder. In that trial, passionflower produced an overall anxiety reduction comparable to oxazepam across the treatment period. The finding comes from a relatively small sample and should be read in that context, but it is notable. The critical difference reported in that study was side effects. Patients on oxazepam reported impaired job performance due to sedation, while patients taking passionflower reported few or no performance-impairing effects. The mechanism involves multiple alkaloids and flavonoids, particularly chrysin, which bind to benzodiazepine receptors in the brain and appear to modulate them gently rather than flooding them. Further research published in Phytotherapy Research confirmed anxiolytic effects across several animal and human models, consistently showing anxiolysis with lower sedative impairment than many pharmaceutical alternatives. Passionflower still grows freely across the American Southeast, scrambles through garden fences across Europe, and is sold as an unremarkable herbal supplement in shops worldwide. The trial comparing it to a prescription benzodiazepine was published in 2001. It generated almost no mainstream attention. No pharmaceutical company had anything to gain from publicizing it. Number 5. Ashwagandha, the adaptogen with the most rigorous modern evidence. Withania somnifera has been central to Ayurvedic medicine for over 3,000 years, where it is classified as a rasayana, a plant used specifically to restore vitality, reduce exhaustion, and extend functional health. For most of the 20th century, Western medicine filed it under folklore and moved on. Then the clinical data started accumulating. A double-blind, placebo-controlled trial published in the Indian Journal of Psychological Medicine gave participants a standardized ashwagandha root extract, or placebo, for 60 days and measured serum cortisol, the primary stress hormone, along with validated anxiety and stress scales. The ashwagandha group showed large, statistically significant reductions in both cortisol and perceived stress scores in that study. These are not modest effects.
A subsequent meta-analysis in the journal Medicine, reviewing 5 randomized controlled trials, confirmed that ashwagandha consistently and significantly reduced both anxiety and cortisol across populations. The active compounds, withanolides, operate on the hypothalamic pituitary adrenal axis, the system that governs the body's entire stress response. Ashwagandha does not merely mask the feeling of stress. Clinical trials show measurable reductions in the hormonal output of the stress cascade itself. Research published in the Journal of the International Society of Sports Nutrition further demonstrated improved muscle recovery, endurance, and testosterone levels, effects that have now generated significant commercial interest. Which is why ashwagandha is the one plant on this list that has partially escaped obscurity. Supplement companies have found it. The problem is quality and standardization. Most commercial ashwagandha products are poorly standardized for withanolide content, meaning the active compounds that produced effects in trials may be present at much lower levels in many retail products. The science is rigorous. The supply chain, for most consumers, is not. Number 6. St. John's wort, the most studied antidepressant you were told to ignore. Few plants have attracted more clinical research or more deliberate suppression of that research's implications than Hypericum perforatum. St. John's wort has been used as a treatment for what we now call depression and anxiety since at least the ancient Greeks. Dioscorides documented it in the 1st century AD. It remained a standard medicine in European practice for centuries. Then, selective serotonin reuptake inhibitors arrived in the 1980s, and St. John's wort was quietly repositioned from medicine to myth. Here is what the clinical literature actually shows. A landmark review from Cochrane analyzed 29 clinical trials covering over 5,000 patients and concluded that St. John's wort was significantly superior to placebo and similarly effective to standard antidepressants for the treatment of mild to moderate depression. The crucial additional finding, the herb produced significantly fewer side effects than synthetic antidepressants across many measured categories, including sexual dysfunction, nausea, and sedation. A further meta-analysis published in the British Medical Journal reached similar conclusions. 2 important caveats. First, there is geographic heterogeneity in the data. Trials originating from German-speaking countries tend to show larger effects than some others. And second, St. John's wort has clinically important drug interactions. Its active constituents, including hyperforin and hypericin, modulate serotonin, dopamine, norepinephrine, and GABA simultaneously, which may explain both efficacy and the comparatively low side effect profile. But they also induce cytochrome P450 enzymes. This produces real interactions with anticoagulants, oral contraceptives, antiretrovirals, and other medications. Anyone on prescription medication should discuss St. John's wort with a doctor before use. For people not taking interacting drugs, the evidence base for effectiveness in mild to moderate depression is stronger than many realize, but it is not a blanket recommendation for everyone. A Cochrane review said so. That review was published in 2008. It changed almost nothing about how mainstream medicine approaches the plant. Number 7. Milk thistle, the liver protector with pharmaceutical-grade evidence. Cilibium marianum grows as a roadside weed across most of the world. It has purple flowers, spiny leaves, and a compound in its seeds, silimeri, that has been the subject of serious pharmaceutical research for over 50 years. In Germany, a silymarin-based preparation called Legalon has been a registered pharmaceutical medicine for liver disease since 1969. In most of the English-speaking world, milk thistle is sold as a health food supplement between vitamin C and ginkgo biloba. The disparity between those two positions represents a striking failure of information flow. Silymarin, a complex of flavonolignans extracted from milk thistle seeds, acts through several distinct hepatoprotective mechanisms. It stabilizes hepatocyte cell membranes, reducing toxic uptake. It inhibits leukotriene synthesis, limiting inflammatory damage. And it stimulates ribosomal RNA polymerase, which appears to accelerate regeneration of damaged liver tissue. A review published in the American Journal of Gastroenterology examined the clinical evidence across multiple conditions and found significant support for silymarin's hepatoprotective effects in alcoholic liver disease, certain cases of viral hepatitis, and toxic liver damage. Most dramatically, silymarin, as in silibinin or silibinin-containing preparations, is one of the few compounds with documented usefulness in cases of Amanita phalloides poisoning, the death cap mushroom, which causes the majority of fatal mushroom poisonings worldwide. The evidence includes retrospective case series showing improved survival when intravenous silymarin or silibinin was used as part of treatment. These are not randomized trials, so clinicians debate the extent of benefit, but emergency medicine practice in some centers has moved toward making intravenous silymarin more widely available because of these signals. It grows by roadsides. People spray it with herbicide because of the spines. 4 more plants have fallen back into view, and each one follows the same pattern: genuine, published, peer-reviewed science, mechanisms of action that are understood at the molecular level, and a status in mainstream medicine that bears almost no relationship to the weight of evidence behind them. The next plant on this list was classified as a military secret, not because it was dangerous, because a government discovered that it made their soldiers significantly harder to break down under extreme physical and psychological stress, and they wanted to keep that advantage to themselves. Number 8. Rhodiola rosea, the Cold War military secret growing on Arctic cliffs. In the 1960s, the Soviet Union had a problem. Elite soldiers, cosmonauts, and Olympic athletes were being pushed to the absolute edge of human performance, and the edge was breaking them. Fatigue, cognitive failure under pressure, impaired physical recovery. The state needed a solution that was not a synthetic stimulant, not detectable in doping tests, and not dependent on a pharmaceutical supply chain that could be disrupted in wartime. They found it growing on cliff faces in Siberia, Scandinavia, and the high-altitude regions of Central Asia. Rhodiola rosea, a succulent plant with small yellow flowers that had been used by Viking warriors before long sea voyages and by Sherpa guides in the Himalayas for altitude endurance. Much early Soviet research into rhodiola was classified for decades. When those findings became available to Western scientists after the Cold War, they were compelling enough to trigger a large body of follow-up research. The term adaptogen, a substance said to non-specifically increase resistance to physical, chemical, and biological stressors, was coined largely in response to observations from rhodiola and related plants. The term is useful shorthand, but it remains somewhat loosely defined in Western pharmacology, and the quality of studies in the literature varies.
A comprehensive review drawing on more than 100 clinical and preclinical studies documented effects on stress resilience, mental fatigue, physical endurance, and cognitive performance under pressure, while noting heterogeneity in study design and outcomes. A randomized, double-blind, placebo-controlled trial in physicians working stressful night shifts found improvements in mental fatigue and cognitive performance within the first 2 weeks, promising real-world data, though not definitive on its own. The mechanism centers on rosavin and salidroside, compounds that can modulate cortisol release, influence serotonin and dopamine synthesis, and affect expression of cellular stress proteins. Unlike stimulants, rhodiola does not appear to push the body past its capacity. Rather, clinical work suggests it raises the threshold at which the stress response is triggered, and may accelerate recovery when stress occurs. Many clinical trials used extracts standardized for rosavins and salidroside, a detail that matters when comparing products and results. It grows wild across the northern hemisphere on rocky, high-altitude terrain. For decades, much of the most rigorous research lived in Russian-language documents. The rest of the world had to wait for the Cold War to end before the science became widely visible.
Number 9. Nettle, the weed that science keeps vindicating. Urtica dioica is the plant most people have a visceral reason to dislike. The sting is immediate, unambiguous, and memorable. It colonizes disturbed ground, spreads aggressively, and is generally treated as a nuisance to be eradicated. This is a significant mistake. Stinging nettle is one of the most nutritionally dense plants that grows wild in temperate climates. Nutritional analyses show dried nettle leaf contains protein levels comparable to legumes, alongside substantial concentrations of iron, calcium, magnesium, potassium, and vitamins A, C, and K. In populations where food security is variable, this is not a trivial observation. It's a freely available, self-propagating, nutritionally rich green that most people are actively destroying. Beyond nutrition, the anti-inflammatory evidence is substantial but mixed in quality. Laboratory work and controlled studies show that nettle leaf extracts can inhibit several pro-inflammatory pathways, including NF-kappa B and multiple cytokines. Some clinical trials report symptom relief for allergy rhinitis, comparable by self-report to antihistamines in a portion of participants. Other trials are smaller or use different preparations, so results vary.
For benign prostatic hyperplasia, several double-blind trials, including work from Europe and other regions, have reported improvements in urinary symptom scores with nettle root extract, and nettle root is commonly used in phytotherapeutic protocols for prostate health in parts of Europe. As always, study methods and product standardization differ between trials. The sting disappears completely with blanching, drying, or blending. What remains is one of the most versatile medicinal and nutritional plants on the planet, growing for free in almost every garden, hedgerow, and patch of disturbed soil in the Northern Hemisphere. The reason it is not universally accepted in mainstream Western medicine is less about the absence of evidence than about study heterogeneity, commercial disinterest, and the plant's persistent weed reputation. Number 10. Hawthorn, the heart plant with 1,000 years of evidence behind it. Every list has a final entry that earns its position not through novelty, but through sheer weight of accumulated truth. Crataegus monogyna, common hawthorn, has been used as a cardiac medicine in European and Chinese traditions for over 1,000 years. In traditional Chinese medicine, it was prescribed for chest pain and digestion/circulation. In medieval European herbalism, it was called the heart herb. Hildegard von Bingen wrote about it in the 12th century. It grows as a hedgerow shrub across most of the Northern Hemisphere, producing white blossom in spring and deep red berries in autumn. The clinical evidence that has accumulated around hawthorn since the 1980s is among the most consistent for any botanical medicine in cardiovascular research, though trials vary in size and methodology. A systematic review in the American Journal of Medicine examined randomized controlled trials of hawthorn extract for chronic heart failure and found improvements in exercise tolerance, maximum workload capacity, and measures of cardiac efficiency compared to placebo. The large SPICE trial and other European studies used standardized hawthorn extracts, often the WS1442 preparation, which matters for reproducibility and clinical interpretation. The mechanisms are plausibly understood. Oligomeric proanthocyanidins and vitexin in hawthorn appear to produce vasodilation, reduce peripheral vascular resistance, improve coronary blood flow, exert antiarrhythmic effects, and provide modest positive inotropic action on cardiac tissue. In plain terms, hawthorn can help the heart work more efficiently and reduce the workload required to circulate blood. These effects make it a useful adjunct in some cases of chronic, mild to moderate heart failure in clinical studies, but it is not a substitute for prescribed cardiac medications or medical supervision. It flowers in hedgerows every May. Birds eat the berries, farmers cut it back as agricultural waste, and for 1,000 years, in every medical tradition that paid attention to what grew nearby, it was known as the plant for a struggling heart. 10 plants, 10 bodies of published, peer-reviewed, reproducible evidence, with the recurring caveat that study quality, product standardization, and sample sizes vary, and a single pattern running through every one of them.
These plants were not forgotten because the science failed. The science, in many cases, had not even been attempted until recently, and when it was attempted, it often arrived at the same uncomfortable conclusion. What grew wild and free in meadows, hedgerows, and cliff faces across the world, what healers cataloged and communities relied on for generations, was not merely superstition. It was careful, accumulated, transmitted observation about what actually worked, waiting for instruments and methodology to catch up and confirm what people had already known. The pharmaceutical model tends to treat this history as pre-scientific noise. What these 10 plants suggest is something different, that the noise was a signal all along, and that we are only now learning to hear it properly. There are more, far more. Plants sitting in roadsides and field margins and forest understories right now are largely ignored, with research papers about their mechanisms accumulating in journals that most people will never read. That is exactly what this channel exists to change. If this video gave you something worth knowing, something you will actually carry with you, please share it with someone who needs it. Hit the like button so that more people find it. And if you want to be here when we go deeper into the next forgotten plant the modern world overlooked, subscribe now and ring the notification bell. The science is there. The plants are there. All that is missing is the attention.